Hello everyone, I'm going to talk to you a little bit about rotator cuff impingement syndrome. This is where part of your rotator cuff gets impinged underneath the spine and acromion of your scapula. And if you don't know what the rotator cuff is, it's a group of muscles that help stabilize your shoulder or your humerus as you're moving around your shoulder. And you can see some of the muscles here. The usual culprit that gets impinged is one of the muscles of the rotator cuff, known as the supraspinatus, which, as you can see here, has little space to go underneath the acromion, and sometimes it can get irritated and inflamed, and that little space can narrow even further, and you can have symptoms like lateral shoulder pain. The most common age range is 35 years old, and I mentioned that the supraspinatus tendon can get impinged, but also the subacromial bursa. And this can be, you can acquire this syndrome from things like overuse or trauma. All right, so for our next exercise, we're actually going to do a stretch. This is called a doorway stretch. He's going to raise both of his hands up and lean into the door frame just enough to where you feel a firm bit of stretching there, nothing that should be painful. And we are stretching the pectoralis major and minor by doing this, helping support good posture. And if that is too much for you, you can also do one arm at a time, like so, and you can get a bigger stretch by rotating to the opposite side as well. And you would want to hold this from anywhere to about 10 to 30 seconds.
So this exercise works on range of motion of the shoulder joint. It is called the wall slide. So I'm going to have the patient take this towel right here, and you could also do it without a towel, but since he has a fresh rotator cuff injury, we'll use the towel for ease. He will put it here, press into it with your arm, and then at various angles, go up the wall as far as you can. You could also come down here to the side as well, and go up the wall as far as you can without inducing any pain, just until you feel a good stretch. And this is essentially working on the active range of motion of his injured shoulder.
All right, next exercise we're going to do is called shoulder pendulums. I have the patient use his non-injured shoulder, and we're first going to help him with the exercise. So we're going to just let his arm go limp. We're going to move him side to side without him putting any force on that shoulder, because we're just doing this for a distraction force to relieve pain if he's having pain during the exercises. So then I'd have him active assist, so he'd start moving his hips, and then I'd let him do it on his own. Yeah.
So this next exercise is called the thoracic latissimus stretch. This is a pretty convenient exercise because you can do it on your couch, you can do it on a low table, anything like that. If you want to go ahead and crouch down for me, all you're going to do is you want to get in a kneeling position, stick your elbows onto the table, and then extend your upper back, your spine up as much as you can, and you should feel a stretch about right here. That's your latissimus dorsi, which can commonly get tight and inwardly rotate your shoulders, which can exacerbate your symptoms. And you're also getting some good thoracic mobility while doing this as well.
This next exercise is also a range of motion exercise. It is supposed to be done with a long cylindrical item. It is called the wand exercise. At your house, you could use a broomstick, a golf club, or a PVC pipe, anything like that. It is supposed to help with active range of motion of your injured shoulder. So what I'm going to have the patient do is take the wand here, and we're going to act like his right shoulder is the affected one. The first movement we're going to work on is external rotation, because that is the first movement that is most inhibited during a rotator cuff impingement. So like he's doing right now, you're going to take the wand, push your affected arm out to the side, making sure that your elbow is tucked in. So that is working on active range of motion of external rotation. And then another movement we're going to work on is abduction. So he is going to take his arm, his affected arm, and keep it straight, and use the other arm to push the wand up and move his arm into abduction. That is the second most affected movement in rotator cuff impingement. And then last, we're going to work on shoulder flexion. So it's essentially the same movement as shoulder abduction, but instead of going out to the side, he's going to use the wand to push his arm in an extended position at the elbow straight up into the air as far as possible. So for our first strengthening exercise, we're going to be doing an exercise called no monies. You can have the patient sitting like he is or standing. I will hand him this TheraBand here. And what you're going to do, you're going to hold it just like that. Keep your elbows tucked in at your side and pull apart, taking your arms outward away from your body. This exercise is meant to strengthen scapular retractors and also the rotator cuff muscles that it is facilitating is the teres minor and the infraspinatus muscle.
All right, so for our next exercise, we're going to do T-band rows. So I'm going to give the patient our yellow T-band because he's pretty fresh. Yellow is the lowest here to get here. So we're going to instruct him to pull straight back, and then we're really focusing on these scaps coming together. I'm going to give him some tactile cueing just to make sure he's coming together correctly. It's really just focusing on the scapular retractors for this exercise. You're doing a great job, Tim. All right, so our next exercises are called the Houston exercises. We're going to show you 3 different examples of that. First, I'm going to have the patient go into a Y. So we're going to have our thumbs up, straight out in a 45-degree angle, not in abduction or flexion. So we're going to go straight up like that. That exercise is working our supraspinatus, the major, it initiates movement of flexion and abduction. And then we'll move into our next position, which is the T position, which is straight up to the sides, thumbs up. You're doing a great job, Ben. The next exercise, so this is working our infraspinatus because it's really compressing the external rotation of the scapula. And then we're going to move into our last exercise, which is an A, so it's just straight back where the thumb is neutral. This exercise really works on our teres minor, and this is really just a great exercise for someone who's just recently passed their passive range of motion. They're able to do exercises without weights, just because it has good muscle work.
It's important that during this home exercise program that you do the range of motion and stretching activities prior to the strength activities, because it is important that strength follows range when it comes to healing of a rotator cuff injury. It is important that when performing these exercises, you perform them slowly and with control and not focusing on speed and intensity, but rather focusing more on form and doing it correctly. Also, during everyday life, use your unaffected arm or both arms when doing daily activities instead of the affected arm, because that could make the injury more severe. During the home exercise program, when you're doing the exercises, make sure to listen to your body, because a dull ache is normal while doing these exercises, but any sharp pain could mean that the injury could be getting worse. Also, in your everyday life, avoid overhead activities and lifting heavy objects, because that is another indicator for making the injury more significant. And last but not least, After performing these exercises during the home exercise program, emphasize the use of ice for around 15 to 20 minutes to reduce inflammation and manage your soreness.